start your day with telling the students what's the purpose of this procedure, why it's needed, especially for unconscious patient. And everything is in the book. Okay, I want you to discuss it to your students. Okay, I'm going to show you exactly how it is done from the very start up to the very end. And I might have some emphasis on certain steps because I want you also to impart this to your student that they should start from the very start and not exactly in the procedure itself. Okay, so the first thing that they're going to do is always ask your students, hold this one always for the patient identification. Okay, and like this, we'll go to the bedside and then you will introduce yourself. Good morning, sir. I am Mr. Leo Labraga. I'm your nurse for today. And I'll be performing oral care if the patient has relative, especially if the patient is unconscious. Okay? And once the students go to the patient's bedside, patient's privacy, and then hand hygiene. This is very, very important because it's in the checklist. Okay, hand hygiene. And then after that, you can start patient identification. Okay, oral care for unconscious patient. The patient is unconscious. If the relative is there, you can still continue the activities. Okay, and the nurse for today, and we're going to assess the patient, and we'll see if we're going to perform oral care. So, ma'am, can you tell me the name of your patient? Okay, can I check the patient's hand? ID band? Okay. Muhammad Ali, 1, 2, 3, 4, 5. I'm going to verify with my chart. It's Muhammad Ali, 1, 2, 3, 4, 5. So this is my right patient. And explain the procedure to the relative or to the patient. Okay? So today I'm going to assess the mouth because the patient has been unconscious for several days, and I will see if there's a need for oral care. I'm going to do some assessment, and we will see if we're going to do oral care. Okay? Now, when you go to the patient's bedside, it is very important that you already have these things with you. These are exactly the things that you're going to use. It's difficult to assess if you're going to do the initial assessment to your patient. So initially, when you go to the patient's bedside, make sure you have a pair of clean gloves. Okay? You should have torch or pen light with you, and then 4x4 gauze. And then tongue depressor with you. And make sure you have an extra kidney basin with you to dispose your used materials. So initially, this is what you're going to bring at the bedside. Okay? And you're going to start the assessment. Since your patient is unconscious, your assessment would focus on the structure of the mouth itself. And before you do that, of course, turn on your, you put on your There are two ways of providing oral care, but for the sake of laboratory learnings, we're going to focus on unconscious patient. Because conscious patient, just the usual thing that we do, and students can do that. But for unconscious patient, the procedures is quite complex and it requires some skills. Okay, I put on my gloves. The next thing that you're going to do is to prepare your tongue depressor. This is very important. You need to protect, you need to put a pad with your tongue depressor using this 4x4 gauze, just like that. Okay? And then do what? And then like that. And then on your other hand, you should have your torch. At this point, you can start assessing the mouth structure of your patient. Without even going to the mouth itself, you can try to see the lips and assess. Start with the lips, the appearance. Okay? If it is too dark or too dim, you can use this one. And this one can use to support the mouth or the lips. And the student should verbalize the findings. I'm going to assess the lips. What can you see? What can you observe? The lips is dry. It has some wounds or it has some dirt. Okay? And then after checking for the lips, at the same time, the nurse can also assess for the odor of the mouth. Okay? And it is very important because in the documentation, the student has to write. Now, after checking for the lips and for the odor, the student can use the tongue depressor to assist in opening the mouth. At this point, the teeth are exposed. You can use the torch and let the student describe what she can see. There are missing teeth, there are tooth decay, there are some etc. that they can see. Or there are some food particles stuck on the teeth. Okay? Something like that. Okay? And after that, they can also check for the gums. What can they observe? They know the terms already because in theory kasi we discussed. There are some gum bleedings, gingivitis, or there are some pus, pyorrhea, whatever that they can see. Okay, after checking for the teeth and the gums, they can proceed with the inside part of the mouth. They can do like this. Okay, and try to observe for the inner structure, the cheek. What can they see? Are there lesions? Is it dry? What is the color? There are wounds, etc. They can also check the tongue. If there are some food particles or any untoward assessment that they can see. Okay? They can also try to check the roof of the mouth for any issues and base of the mouth. Okay, that is your assessment. And then after that, before you end your assessment, one important thing that you need to assess is for the gag reflex. Although it is expected that unconscious patient might have no reflexes at all. However, we also do this procedure for very weak patient. That's why it is very necessary for us to check for the gag reflex. And you need to explain to the student why it is necessary and how to perform it. Okay, with the use of your tongue depressor, you just extend this one and try to touch the posterior aspect of the mouth. Like that. You know, you will not see it. And you need to tell your students what is the expected and normal gag reflex reaction. And what is expected if the patient doesn't have gag reflex. And why is it necessary to have it. You need to explain those things. So you will see, okay, I'm going to check for the gag reflex, so there's no gag reflex. That means you need to be very careful when you do your mouth care procedure to the patients. And you're done with your assessment to the patient. Okay? And then, see, I have two kidney basin here. You can dispose the used materials here separately. Okay? Okay? And then you do your hand hygiene again. And then you tell the attendants or the relative that you're going to prepare the materials and you will be back. Mom, I'm going to prepare the materials. We're going to do oral care to the patient. I will be back in a few minutes. Okay? And then you go outside and you prepare your materials. So what are the things that we need for oral care for unconscious patient? Okay, for unconscious patient, we need to have, this is very important. We call this one as oral hygienic set. In the lab session with your students, each one of them will be provided one. They cannot have two because we have economic issues now. So if they use this one and they want to practice again, make sure to recycle. But each one of them will be given this one. Inco sheet will be needed. Okay. What else? Suction catheter is very important. Water to, that this will aid in suctioning the mouth later on. Okay, now, this is very important, the cleaning agent. It depends on the hospital where you are working because each hospital have their own preferences. But for student learning, we will only use mouthwash. But explain to them when they go to Royal AFH, they might have different cleaning agent. But for now, this is what we're going to use. Okay. We're going to use also moisturizer or Vaseline to moisturize the lips, especially for unconscious patient. The lips are prone to drying and cracking, and eventually it will get wounds. Okay? And of course, if we're going to use moisturizer or Vaseline, we should have at least cotton applicator, but we don't have cotton applicator. They just give me cotton buds. But in the hospital, they have cotton applicator. Yeah, okay. And this will be used to apply the moisturizer later on the patient's lips. What else? We need to have another pair of clean gloves. Okay? So that means you have two pair of gloves. One for assessment and one for the procedure itself. And of course, you need to have a large tip syringe or a septo syringe. This will be used later on when we flush or rinse the mouth of our patient who is unconscious. What else? At least we need to have large towel. Okay? And that's it. We are ready to go back to our patient. My materials are ready. So now I'm going back to the bedside. Okay? Any questions with the preparation of materials? So at this point, they're going back to the patient's bedside again. Ideally and normally, even if it is the second or third time that they go back to the patient, they still do patient identification. But for our lab session, the most important one is the first one. But in the actual area, every time they go back to the patient, they always do patient identification. So I'll do patient identification again. I will provide privacy because this is a private procedure and patients might be embarrassed by the family members. Okay, so what is the first thing that I'm going to do now? Okay, now that I have assessed the patient, the next thing that I'm going to do is to prepare the patient. Specifically the position of the patient and the position of the bed itself. Since our patient is unconscious, the ideal position would be lateral position or sideline position because students might not be able to understand what is lateral. But they know what is sideline position. Either on the right or either on the left. And when you do this procedure, you should tell them why. Why it should be lateral. And we know already that because the patient doesn't have gag reflex, the position will allow the gravity to pull the water, the solution into the mouth to prevent aspiration. Okay? And now you might need some assistance or you can do it by yourselves. You are going to position your patient in lateral position. In doing this procedure, you might need additional pillows with you to support the patient. So I have 2 additional pillows there. So the first thing that I'm going to do is to position the patient towards my side because I'm here, I'm working here. So the patient should be facing towards me. Okay? Since I'm here, I can put down this one. Okay? One hand over the head area, other hand over the chest. Oh, sorry. Okay? And one leg over the other. Okay? And you can turn the patient towards the side. Don't you worry, on the next week, after this procedure, we will be discussing how to properly move the patient. Okay? And then provide support at the back. And then you can put one pillow here. Please do not leave your patient. It is very important because there is no side rail. If the student is very afraid that the patient might fall, it's fine to raise his side also. Especially the student, they might be afraid. Okay, so this is the position. Now, never stop doing this one. After the patient is placed in lateral position, you need to reposition the bed. And the bed should be Trendelenburg's position. Okay, the patient in lateral, at this point, the head part of the bed should be lower down and the foot part should be higher. Again, you need to explain to the student why this is important. Again, it has something to do with the gravity and the aspiration again. Okay? Now the patient is in the right position. Okay, after you position the patient, you can now put on your gloves. Okay? This is a clean procedure. This is not a sterile procedure, so you can put on the gloves now. You can stand if you want. Anyway, the camera is not working.
Stop.
You can stand, ma'am. If you want, so you can sit. Okay. So now, before I do anything, I'm going to check first if my suction is working. Okay, it is very important to teach your students how to manipulate the suction, how to turn it on, how to turn it off. Now I'm going to check if it is working by picking up the opposite end of the tube and checking if there is suction. So there's a suction multimeter. Okay, I'll just put it here. Actually, at this point, I can now connect my suction catheter. Okay, you may also want to discuss the different parts and the use of this suction catheter to your student. It's very important. So now, while the suction is turned off, I'm going to connect the other end. But I'm not going to remove this yet. Okay, I'll just put it on the head part. Okay, because later on I'm going to use it. At this point, I'm going to place this input sheet. Now in the checklist, it says there input sheet and then you put a towel. But for this procedure, an input sheet itself is fine. Okay, how do you put this one? We are going to place this one under the patient's head, because we are anticipating some dripping of water later on and we do not want to soil the bed. However, if the student is expert and they are nurses already, anyway they are on this side, they can put this down. So, okay? And so that they have an accurate access to the mouth itself, they can move the pillow to that side. Show you that. Like that. Because now I'm going to put another kidney basin in the chin area. It is where now the water will be collected here. If you cannot see, you can stand. This one. Mom, you can actually come closer. What I usually do before I start, I cover the patient with towel. It's fine. It's up to you if you want to cover, but for me, I usually cover my patient with like this because there might be some splashes of, you know. Okay, make sure your patient is protected. Do not leave this area. Okay. So at this point, I'm going to prepare my set. Okay, I'm going to open now the oral hygienic set. Okay, this is very, very important because the essential things that we're going to use later on are inside. Again, this is a clean procedure. The student might say, you're touching anywhere. This is a clean procedure. Okay? And you need to inform the students what do they expect inside. Actually, we have 10 mouth swab. We're not going to use toothbrush, by the way, because most of the patients who are unconscious, their oral structures or tissues are very fragile. That's why we're going to use a soft swab. Okay? And we can expect also another set of 4x4 gauze and tongue depressor inside. Okay? And the yellow bag, which is very, very important because it is where they're going to discard used swab. Remember, the swab, after we use it, we consider it as infected. That's why it's yellow. And this is very, very important. The placement of your yellow bag depends on where you're going to position yourself when you do the oral care. Since I'm going to stand here, the yellow bag should be facing towards me because it's difficult to discard your materials later on if it is on the opposite side. It's here. Teach them how to remove this one. The sticky part, shwea, but not the entire this one because we're going to tie this one later on. And attach it here. Okay, like that. Like that. And then open it before you start the procedure. Because later on, you cannot just touch that one. So it's open. Okay? Now I'm going to prepare this one. I'm going to pour the oral agents or solution that we're going to use. Okay? You can use this one or you can directly pour this one. There's no problem.
Actually, they have mixed it with water.
Yeah, usually they mix it with water.
This,
Okay?
this for that.
Okay. So now I'm going to use this one again. Again, cover it with gauze, or else it might cause injury to the mouth structure. Okay? And you can actually start the procedure. Like this. Okay. Now, for the purpose of learning the procedure, we're going to do it that big mouth so that they can actually see and appreciate the different parts of the mouth. Okay. And show them how to properly support the mouth with the use of tongue depressor while the other one is cleaning the mouth. And tell them that the first part that they're going to clean is the gingival sulcus. There are sequences and there are names that need to memorize. The first part is the gingival sulcus. Now this is very important. Before you start cleaning the mouth, try to orient them with the different parts of the mouth. Like this is the gums, you know already. This is the teeth. But in between the gums and the teeth is called gingival sulcus. And most of the dirts and the food particles are stuck in this area. Okay? The margin between the gums and the crown or the teeth is called gingival sulcus, and that's the first part to be cleansed. And how do you do that like this? See? There are gingival sulcus on the upper teeth. There are gingival sulcus on the lower teeth, and there is also sulci inside. How you can do that? With the use of swab. Okay, place it over the gingival sulcus, and you can do this one. And you will ask your students to enumerate. This is gingival sulcus. Okay, up and then down, and then inside, up and down. That's the first part, gingival sulcus. And drop. The next part would be the sulcus to crown. The sulcus is here. The crown is here, sa? This is the sulcus, the upper portion of the teeth, and this is the crown. And you can actually do that by moving from up and down, like this. Let's start here, like that. Just like how we brush our teeth. And then you can do it also down, you can do it also inside. Okay, this is sulcus to crown. And then drop. And then the next one is the biting surfaces. Biting surface is this one, the one that we use in biting food. Okay? And you can clean this one by moving the oral swab more forward and backward. Like this. Okay? You can also do it in the lower teeth. And this part. The next part is what? Okay, this is very important. You can start cleaning the cheek. There are both sides, right and left, and this is very important. On each side, we use only one swab. And the rationale there is that we do not want to spread the infection from one side to the other. Okay? So I'm going to give the swab on the other side. And then this part. And then on the other side. At this point, you can clean the roof of the mouth. The roof of the mouth is here. Okay? And then the base of the mouth, just below the tongue. If the tongue is the tongue.
From the back.
Okay, from the tongue. If this is the tongue.
All in one.
Yeah. Okay? And of course, you need to include now the tongue. Okay. And you include also the lips. And you have adequate swell. So the lips,
4.
and you're done. Let the students memorize the sequence, the different parts, because it is very important. Now, after this, after you perform the oral care to the patient, it is very important to rinse the mouth of the patient. Okay? And at this point, I'm going to prepare my acetous syringe. When you flush the mouth with the use of acetous syringe, normally we only allow 10 ml in every flushing. The student might ask you, why not 20, 30? Because the more you put water, the more the risk of causing aspiration. That's why in every flush, at least 10. Okay, I will prepare this one, I'll put it there, and I will prepare my suction. Okay. At this point, you can discuss the different parts of the catheter to your student. What is the purpose of this one, and what do they expect at the very end, and how to hold this one, and how to use this one. Okay? And normally when you do the procedure, we ask one student to help to assist in turning on the suction. Okay? Normally, we advise the student to do like this. Coil on one other hand, and the other hand will control the suction itself. I think you are already familiar with the use of this button to apply suction like this. Okay, now this is very important. Okay, before you start flushing the mouth, make sure that the suction is on the mouth and turn on the suction. It's very weak. Okay, now I'm going to start flushing. This is very important also. Flushing, there is a right technique. You should start flushing from the upper part. The upper part is here, and this is the lower part. And the student might ask you, Mister, why we cannot flush down? Why it is up? Again, we tell them the rationale, because the flow, the gravity of the water comes from the top portion and it will go down. And once we flush down, it will never go up. Okay? And this is very important. When we flush the mouth, it should not exert a lot of pressure, or else it might go to the patient's respiratory system and the patients might develop aspiration. Okay? Like that. See? Upper part. However, right after you do the suctioning, make sure, right after you flush the mouth with water, make sure to apply suction right away. Okay, like this. And ideally, the suctioning should be done in the lower part this time. Why? There's no water in the upper part. The water is down. So the suctioning is here. Or you can do like this. It depends on their comfort, so that their other hand can do like this. Since our suction is very weak, we cannot appreciate if it is working or not.
The dummies are also having holes. It goes somewhere else.
Yeah. Usually, if the suction is well, you can hear something like that. And student will appreciate that the suction is well. Anyway, we'll talk to Abdullah to fix this one. Okay? Now, can they repeat the rinsing of the mouth? Yes. If you think, based on your assessment, that there's still food particles, flush again 10 ml and apply suction again on the lower part until the return flow is clear. Okay? For example, we're done. I'll check again one last time.
You cannot increase.
Mapping.
Not the suction. The water goes somewhere else.
Somewhere
It is not. It is not very old and later it will not come from the head here.
Mapping. Okay, just before you discard this one, you can also try to flush this one with water. It's very weak.
I think.
The sound should be like that when the student suction the mouth. Okay, how to dispose this one? Okay, ask your student to hold this one in one hand. Okay, and while the catheter is inside, you can dispose this one.
It's like
Now, yeah, by the way, suction is not unlimited. You need to recycle that one. Now, do not let your student touch the patient with bare hand. You can get another one, gloves. Okay. You can actually use this one to wipe off water in the mouth, or if you have a separate towel. At this point, you can now apply the Vaseline. Okay? Especially on both ends of the lips. Why? Because it is prone to cracking. And you need to tell the students why it is important. When the lips is cracked, the wound will develop and the infection will come. So, yeah, like that. Okay, now that you are done, you can now dispose the materials that you have used. This one, dispose. Okay. You can remove this one, Shwaya also. Students know already how to dispose this one. You can put it on the yellow bin. We will use it, sorry. Okay, and then you can now reposition the patient back to its original position. See? The water is leaking out. This is the problem. By the way, expect leaking like this because our mannequin are older than the first batch of nursing students. Okay? Put the patient in comfortable position. Reposition the bed again in supine or Fowler's position, whatever it is. And then take care of your materials that you have used. You should know how to take care of this. This one should be disposed inside the yellow bag. And you should teach them how to dispose this one. See? This one should tie this one. You can dispose it in that. And then you can remove your gloves, return back to the original position. And they can go back to the patient and do evaluation. What would be the evaluation? For example, you're done with the procedure. You dispose those things. At this point, you're back to your patient. By the way, evaluation is part of the steps. After you do the procedure, after you replace the materials, after some time, you go back to the patient's bedside and you do evaluation. It's in the checklist. So for this procedure, what are the most important evaluation that you're going to do? What are you going to check with the patient? Of course, it is very important to check for the respiration in the collar of the patient because the risk involved in this procedure is aspiration. So I'm going back to the patient, going to assess the collar is pink, and the respiration is normal. I do not see any respiratory distress. And of course, you include also as part of your evaluation, especially when you do your documentation, is what did you found in the mouth? Okay? Those things. So the color is okay, the respiration is normal, there is no respiratory distress. At this point, you're done with your procedure. You end your procedure with hand hygiene and leave the patient's bedside. In your documentation, I think this is the procedure where you can reinforce the documentation at this point. Because in the past 2 weeks, we did not focus on that. The first part is problem, right? Remember, they assess at the start. They can write everything there. What did they observe? What did they see? You can write it in the problem. Okay? And next is intervention. What did they do? What procedure did they do to address the problem? Perform or refer to the patient, blah, blah, blah. And the last part of your documentation is evaluation. What did they evaluate at the end? The color of the patient. There's no signs of respiratory distress, etc. That is the documentation. Okay? Let's see. I'm trying to shorten the procedure. This procedure is a little bit complex for the students, and this is very challenging
Teacher
also.
also.
Yes, even for me, I can still forget some steps even if I'm here.